presentation today, as Charmaine introduced, is about POTS, and I'm going to talk a little bit about what POTS is and a little bit about um, some of the symptoms and experiences I've had that have led to my diagnosis of POTS. I'm learning about what POTS is as I go, so I'll do my best to answer any questions as best I can. But I hope it's informative and I hope it's helpful, particularly for those who might be experiencing similar symptoms or know of somebody. I was diagnosed with SLE lupus at the age of 16, but I was symptomatic at 13. And so I'm now 48, and I was diagnosed with fibromyalgia in 2013 at the age of 38. I also have Raynaud's syndrome and secondary Sjogren's syndrome, and recently POTS, which was diagnosed a year ago. That should say too ill to proofread correctly, and too ill to work, and have been retired from a 20-year secondary teaching career since 2018. And I live in Melbourne, Australia, with my little cutie cat, Squeaky. I thought I'd just briefly describe what actually happened in my first POTS episode. It was about 2 years ago in the middle of the night. I just sat up, and I felt really dizzy, and I felt really nauseous. I felt sick. I thought I was going to throw up. My heart was beating really quickly, and I was really drenched in sweat. And I was trying to get to the bathroom really quickly, because I thought I was going to be sick, and I was just sort of collapsed on the bathroom floor, trying not to completely pass out. And it took about 20 minutes to sort of settle those symptoms. And I thought I'll try and sit up and stand up and see how I go. And as I tried to sit up and stand up, all of those symptoms returned again. So I was dizzy, felt like I was going to be sick, and the body just started sweating again. It took about half an hour of just sitting there and breathing and trying to stay lucid until it settled, and I felt able to stand up again. But when I did, I looked as white as a ghost, and I was just exhausted and really drained and obviously concerned. I followed up this incident with my GP and my rheumatologist, and after a year of waiting to see a really renowned cardiologist who specialises in POTS, I was diagnosed with POTS a year later. So what is POTS? POTS stands for postural orthostatic tachycardia syndrome, and it's a condition that causes your heart rate to beat faster than normal when you transition from sitting or lying down to standing up. So it's a type of orthostatic intolerance, and it's also referred to as OI, but POTS is the well-known term. It affects mainly women and people assigned female at birth between 15 and 50 years. But men and people assigned male at birth can also be affected. So predominantly a female condition. There is no cure, but there are several treatments and lifestyle changes that can help manage symptoms of POTS. So just briefly, in terms of what each of those words stands for. So postural relates to the position of your body. Orthostatic refers to standing up. Tachycardia is the heart rate over 100 beats per minute, and the word syndrome is used to describe a group of symptoms that happen together. So normally, as Charmaine mentioned at the start, our autonomic nervous system controls all the work our heart and blood does, without us having to really think about it. But when POTS starts to happen, you certainly start thinking about it differently. So normally your autonomic nervous system will balance your heart rate and your blood pressure to keep your blood flowing at a healthy pace, no matter what your body position is in. So if you have POTS, your body can't keep your blood pressure steady and stable. And so because of that, it causes a variety of symptoms. And each case of POTS is very different. People with POTS may see symptoms come and go over a period of years, and in most cases, with the adjustments to the diet, medication, and even physical activity, a person with POTS will experience an improvement in the quality of their life. So how does POTS affect the body? Normally when you stand up, gravity causes about 10 to 15% of your blood to settle in your abdomen, in your legs and your arms. This means that less blood reaches your brain, which can cause a brief lightheadedness. So if you don't have POTS, this lightheaded feeling doesn't happen often because your leg muscles help pump the blood back up to your heart. In addition, your autonomic nervous system turns on a series of rapid responses. So to compensate for the lower amount of blood returning to your heart after you stand up, your body will release the hormones epinephrine, which is adrenaline, and norepinephrine. And people with POTS tend to pull a larger amount of blood in their vessels below their heart when they stand. Their body responds by releasing more norepinephrine or epinephrine to try to cause more squeezing of their blood vessels. So for several reasons, their blood vessels don't respond normally to these hormones. And because their heart remains able to respond to the norepinephrine and epinephrine, their heart rate will then often increase. And so this imbalance that's happening will cause possible symptoms like dizziness, fainting, and exhaustion. If you have POTS, it can actually occur really suddenly or it can develop gradually, and symptoms can happen immediately or a few minutes after sitting up or standing. Lying down can even relieve some of the symptoms, but the major symptoms that can happen but do vary from person to person include dizziness or lightheadedness, especially when standing up, or if someone's been standing for a long time, or even if you're on a long walk. Fainting or near fainting. Forgetfulness is common and trouble focusing, so brain fog. Heart palpitations or a racing heart. Exhaustion and fatigue is very common. Feeling nervous and anxious. Shakiness and excessive sweating. Shortness of breath. Chest pain. Headaches. Feeling sick. Bloating is an example too. And a pale face and purple discoloration of your hands and feet if they're lower than the level of your heart. So blood pooling or poor circulation. And this is one symptom I'm experiencing a lot of, which is disrupted sleep from either chest pain, racing heart, and excessive sweating. And these POTS symptoms can get worse in certain situations, and warmth is one of them. So being in a warm environment, such as a hot bath or a shower, or even on a hot day. Again, standing frequently, such as when you're waiting in line or shopping. If you're participating in strenuous exercise, that can actually bring on some POTS symptoms. When you're sick, so if you've got a cold or an infection, or for women if you're menstruating. So how is it actually diagnosed? It's a really invasive process, and detailed questioning of the patient is really key to an accurate diagnosis. Physical examination and other appropriate investigations will also happen. So the alternative causes of symptoms need to be considered and identified first, that a lot of the symptoms you might be experiencing aren't mirroring other conditions. And patients are often diagnosed by either a cardiologist or a neurologist. And some other healthcare professionals like a GP might also diagnose POTS. So to be given a diagnosis of POTS, a person needs to have the following symptoms. So the POTS symptoms that they have need to be happening when the person is upright and at least over a period of 3 months. A sustained increase in heart rate of greater than 30 beats per minute within 10 minutes of standing. If you're a younger person, aged between 12 and 19 years, you require an increase of at least 40 beats per minute. And these criteria that I've just listed, they may not apply to those people with a low heart rate when it is resting. And there's normally not a drop in blood pressure upon standing. So what are the techniques and tests that are used? Some people might have all of the below tests completed, particularly if you know, results are a little inclusive. But the majority of tests that are used are an electrocardiography or an ECG, and that's mainly to rule out any other heart problems that may cause similar symptoms to those found in POTS. There's the active stand test, and the active stand test is basically under careful supervision, having your heart rate and blood pressure measured. And that's after resting and lying down and then immediately standing up. And this will be after a 2, then a 5, and then a 10-minute period. And this particular test may bring on symptoms of POTS. So some people may feel unwell and they may even faint. This is quite a traditional test, the head up tilt table test, and it involves lying on a table that can be mechanically tilted to an angle of 60 to 70 degrees in a quiet, dimly lit temperature control room. And it's held in that position until the patient's circulation becomes compromised. So it's, again, these sorts of tests are trying to activate symptoms so that doctors can actually see what's happening. There's a 24-hour ambulatory blood pressure that may be completed. So a blood pressure cuff might be put on your arm and that will intermittently check your blood pressure. Mainly either in a 30-minute period or during the night when you're sleeping every hour. And the patient is asked to go about their usual daily activities so that you can, reproduce what you normally do to reflect some of the symptoms that might be happening so that that reading is as realistic as possible. And doctors will look to see if there is a drop in blood pressure at the time of the symptoms that you're having. And then there's Holter monitoring as well, which is a heart monitor device. It's a battery-operated device that will continuously record your heart's activity for 24 hours. It detects the heart rate and its rhythm and can simultaneously measure your activity. And it enables doctors to decide whether the heart rate is appropriate for the circumstances. For example, if you've recorded 160 beats per minute at the gym, well, then that's understandable and making sense. But if that same recording is happening at the supermarket while you're standing still, well, then that becomes really alarming that something's not quite right. Echocardiograms, 24-hour urine collections, and even blood tests can be conducted as well. So who is at risk of developing POTS? So you're at a higher risk of developing POTS after experiencing the following stresses. Significant illnesses, particularly viral illnesses like mononucleosis, and in addition to that, like we're seeing with long COVID. Pregnancy, maybe physical trauma such as a head injury, surgery, and unfortunately for autoimmune warriors like us, we're a little bit more vulnerable, particularly people with Sjogren's syndrome, with lupus, with celiac disease, type 1 diabetes, multiple sclerosis, and even those with Lyme disease and a condition called Ehlers-Danlos, they're more likely to be susceptible. So how is POTS treated and how is it managed? As said earlier, everyone's symptoms are quite different, but shared in that similar way. But they might have only a couple of symptoms, or some people might have a whole range. So it's really down to you and your doctor to figure out a way of trying to manage things. And it's a process of elimination as well in trying different things, as this condition is still very early in its infancy. It was only really emerging as a condition in the mid-1990s. So because each patient is different, consulting with a physician who has experience in treating autonomic disorders is really important. And the three that we'll focus on that management are good nutrition, exercise, and even medication if needed. People are likely to be told to drink more fluid, at least 2 to 3 litres a day. Salt consumption is increased from about 8,000 milligrams to 10,000 milligrams per day. The wearing of compression stockings, and compression is trying to, keep everything tight and encourage the blood to move. So that might be a recommendation. Even raising the head of the bed to try and conserve blood volume might be suggested. Exercises will be suggested where possible, so something that's more of a reclining nature like rowing or recumbent bicycling, swimming, and even walking and yoga as well are advised. A nutritious diet is very much encouraged, so just focusing on high fibre, complex carbohydrates, protein, or your veggies and fruits and dairy, but also trying to add into all of that more salty snacks to increase the sodium levels in your blood. So more broth and pickles and olives, sardines, nuts or salted nuts, and even anchovies are examples. So little things like that should be added where possible, and avoiding substances and situations that might worsen those orthostatic symptoms are encouraged, particularly stress and alcohol. There's a small group of medications that are used. Fludrocortisone is like a baby steroid, and that is taken to increase salt retention in the body and increase your blood volume. Pyridostigmine is to reduce the tachycardic symptoms. Someone may take midodrine to try and narrow the blood vessels, and beta blockers might also be used as well. What are some of the challenges in diagnosing and treating POTS? Well, basically, the physical symptoms may result in significant disability for people. There are people who cannot work with POTS. They have extreme fainting spells regularly each day. They're in quite a debilitating state. And therefore, trying to control and treat their symptoms is really challenging. And the other challenge is, as we identified, it also exists with other comorbidities. So it exists with other illnesses. And a lot of those symptoms that I've listed as being common to POTS are actually symptoms that pop up in our autoimmune diseases. So trying to figure out what's actually going on is a challenge. And again, trying to get the right person to diagnose is the key as well. There's also frequent diagnostic delay and misdiagnosis, and particularly the symptoms of fatigue and dizziness might be attributed to other things like a stressful life, or particularly when someone's circumstances are explained. So things can go undiagnosed for much longer. Finding someone who's actually an expert in this field is the challenge as well. And a lot of GPs, particularly in Australia, are not as familiar with POTS. So that's an issue again in terms of, you know, picking up on those symptoms and actively trying to find a solution. There's also a misconception about POTS being what's called a teenage syndrome that everyone grows out of, because there's quite a lot of our young people that suffer from POTS. And yes, they might eventually, as they emerge into adulthood, you know, some of their symptoms might improve. It is a misconception that it only affects the young. It's actually, you know, affecting a wide range of people, obviously women, but of many ages. And again, there's that the normal physical appearance that may lead to, you know, disbelief amongst people in your social network who might not understand what you're experiencing, and showing that sensitivity that's an issue as well. A little bit on POTS and long COVID. So as Charmaine said at the beginning of the presentation, a lot of people with long COVID are experiencing POTS symptoms and POTS itself. And a recent study in Australia found that 80% of people with long COVID had POTS, which is quite an extraordinarily high statistic. And again, it's proving difficult to diagnose due to the lack of recognition of POTS by the medical profession, which again is prolonging that diagnosis and effective treatment. Currently in Australia, there are no specialised POTS clinics in public hospitals. So again, that's impacting on expedience of diagnosis and treatment. But the upside is that long COVID patients experiencing POTS are getting a bit of media attention. They're getting, you know, noticed. So the medical profession is sitting up and paying more attention to POTS and other conditions of dysautonomia. So hopefully there'll be more active research into what is, for many people, a really debilitating condition. So in finishing up, I'll just briefly refer back to where I am in my experience with POTS, if that's okay. And hopefully what I share here will make more sense given some of the things I've mentioned earlier. So that first episode in the middle of the night was 2 years ago. And since that time, you know, throughout daily life or at night, I have continued to feel dizzy upon standing. I wake up quite regularly with night sweats. I've noticed I'm more breathless. I've experienced a really strange phenomenon for many, many years that my rheumatologist has not been able to figure out, which is having hot feet at night, to the point where I just have them, you know, hanging out at the bottom of the bed without anything on them, no socks, no doona, nothing. They're just, and they actually go bright red. So I suspect there's something POTS related there. I'm definitely more fatigued. And what was a recent heat wave in Melbourne a few weeks ago at the end of summer, there was about 3 days of really extreme heat, and I just couldn't get through it. And I was in bed for nearly 3 days, just from the hot days, which I'd normally manage. I'd normally, you know, feel tired and struggle with, particularly when we have these autoimmune conditions, but I've really noticed a real shift there that I just could not get through that heat. So, you know, as I mentioned earlier, that those warm conditions, so hot showers and hot baths and anything that's an extremity with the heat, is obviously a real issue with POTS as well. So I've noticed a lot of, you know, changes along the way. My POTS was diagnosed from a 24-hour ambulatory blood pressure test. So I had the cuff on during the day and during the night for 24 hours. And instead of having the heart monitor on for 24 hours, I had a 48-hour heart monitor that recorded my heart rate and activity. So those two physical tests combined with a really invasive 2-hour consultation with a cardiologist culminated in that diagnosis. And during that 2-hour consultation, I think he asked me every single question you could possibly think of regarding nearly every body part. I think he went from the head, the arms, like he covered everything. And questions were, a yes or no answer. And he had like a questionnaire he, set up, and it was like my responses, very much contributed to that diagnosis, as he measured up what he was seeing from those recorded tests based on the symptoms, particularly things like fatigue and sweating and disrupted sleep. And another symptom that's really exacerbated is urination in the night. And that's common in POTS, where all of that adrenaline is being stored up, and in the night you start to it's like your bladder just has to release everything. So it's becoming, in terms of not becoming, but in terms of that diagnosis process, it really was, on one hand, quite interesting to see how he mapped everything together. The challenge also of having lupus and fibromyalgia as well, and for me, wondering how well versed he was in those diseases as well, and trying to eliminate, one symptom from another. I could see his brain was really working hard, trying to, put everything together. And obviously, when there are other existing illnesses for people with POTS, I could see how challenging that is. And it's a challenge for me. I don't know, some symptoms I have, I don't know are lupus or POTS or fibro. They all feel so similar. But I digress. The medications I've tried have been really interesting as well. I tried fludrocortisone at the start. That's been moderately successful. I've noticed I'd feel a little bit more awake. I felt like my heartbeat was a little bit quicker in the morning. I take it in the morning, and when I stand up, I'm not as dizzy. In addition to that, he tried me on dexamphetamine, which was quite an awful experience. It was meant to really, make me buzzing and really full of energy, and it did the complete opposite. And I was constantly nauseous and just wanted to sleep all the time. So we stopped taking that. He then tried Ritalin, and again, similar symptoms as the dexamphetamine. And as I've had a lot of other health issues at the moment, I've just taken a bit of a break. And in the next couple of months, I will try the medication Midodrine and see if trying to close the blood vessels will lift and increase my blood pressure. But yeah, walking through this process, I can see how he's literally trying to throw a range of different medications at these symptoms and trying to figure out what works for me. He also advised me to increase my salt intake by 2 teaspoons a day, which is an awfully large amount and really challenging to add to your meals throughout the day. Instead of compression stockings, he suggested compression underwear, which is equally challenging and uncomfortable and super expensive. So I'm still wrestling with that one. He's encouraged me to exercise when I can and has been really understanding. Can be challenging with lupus and fibromyalgia, but I haven't been able to exercise as I've been recovering from spinal fusion surgery. So I'm at a really low inactive part of that recovery. So I really look forward in the future to seeing when I can move more, if my heart starts to beat at a better pace and my blood pressure lifts and I feel better. And again, the salty foods was another suggestion as well. I've looked for those of you in Canada, if you have POTS or know someone with POTS, there's unfortunately no organisation that I could find, but there are really good websites in POTS UK, POTS Australia, and Dysautonomia International in the US that are really, really excellent with the information they provide. It's my bib, so please know I didn't make any of this up. And a heartfelt big thank you for attending.